Here, I will demonstrate how I came up with recommendations for the Indian Prime Minister so as to help you do your final assignment. First, let's look at this spreadsheet, which is in your assignment folder, of the risk of dying at various ages between 1970 and 2010. So this is the risk of death shown here at the various age groups, and these are the time periods. So overall for India, there was a substantial improvement from about 70% dead before age 70 in 1970 down to 45% in 2010. That's a 35% decline. Very impressive. But let's look at what else was going on in other countries. So one simple comparison is to compare the 45% risk of dying in India in 2010 before age 70 to that in China, which is shown here. In China, you see it was only 26%, meaning India still lags behind its big Asian neighbor. If we go further, look at what happened for Bangladesh over the 40 years. The risk of death before age 70 fell by 41%. And importantly, the risk of childhood deaths fell by a full 80%, as shown here. So the first message to Mr. Modi is that India has done lots, but it can do much better. Second, let's look forward to what is possible by 2030, which is in the next spreadsheet. So by 2030, what is shown here is the population, the numbers of deaths at various age groups that would occur, as shown here, if the 2010 death rates were to continue. So at the current death rates, and among 1.5 billion population shown here, expected in 2030, India will have about 9.2 million deaths before age 70. So the key message to Mr. Modi is very simple, that it is possible to get a 40% reduction in these deaths. So what would that be? Well, very simply, it would be this total times 0.6 or 40% reduction. So that would lead to 5.5 million deaths occurring in that time period. Within that goal, clearly it's possible to reduce the child deaths, which at current death rates would be about 1.5 million deaths, down by 2/3, leading to 0.5 million deaths. Exactly what Bill and Melinda Gates have recommended for the Indian Prime Minister. However, note that the largest numbers of deaths in 2030 will be at ages 50 to 69, fully 5 million deaths at these age ranges. And if we aim for a 1/3 reduction at these ages, that would avoid about 1.7 million of these deaths. So to summarize, my key goals are, as in the Norheim paper, a 2/3 reduction in childhood deaths and in maternal deaths, and a 2/3 reduction in TB, HIV, and malaria deaths, much of which occur at ages 5 to 49, and a 1/3 reduction in non-communicable diseases and injuries. And the non-communicable diseases occur largely at ages 50 to 69. So, are these reductions possible? Well, the best way to look at this is actually what's the progress in the last decade, which is shown in the last spreadsheet, in the major causes of death. So what you have here is these are the different causes of death grouped by income category of countries. So the India belongs to the lower middle income grouping. And here you're shown the 2030 deaths that would occur, and at different age groups, shown here, and at also the change per decade, which was the rate that had occurred in the last year, or the last decade. So is this achievable? Well, let's look at ages 0 to 49, shown here, and overall, from communicable maternal and perinatal conditions, India achieved a 30% reduction in deaths in the last decade. So now what that means is if that were to continue, you would get a 51% decline by 2030. Well, how do you calculate that? Very simply. 1 minus 0.7 times 0.7 equals 0.51. And the 0.7 is basically 30% removed from 100%. The 0.7 is also what we say would be the progress if this progress from 2010 were to continue to 2030, meaning 70% decline in 2010 to 2019, and then another 70% decline in 2020 to 2029. So that's important. At these death rates, if they continue and the declines continue, India could have the deaths before age 50. But certainly, the Indian Prime Minister could do more by emphasizing, for example, faster reductions in childhood deaths. That's fallen by 34%, but it can be decreased even faster. In the decade of the 2000s, the overall risk of death from communicable maternal and perinatal fell by 34%, but some specific conditions like vaccine-preventable deaths fell by 67%. Now, by contrast, you see that the non-communicable diseases have actually shown a less of a decline, and that's shown here. These are the non-communicable diseases, and we just scroll over and look at the Indian numbers, again at the most important age group for these, which is 50 to 69, and that shows only an 8% decline. At these death rates, India would reduce NCD deaths only by about 15%, 0.92 times 0.92, meaning the 8% decline that you see for each of the decades from 2010 to 19 and 2020 to 29. That 15% decline is well short of the 33% reduction that we said would be our goals. So a lot more needs to be done to knock down child and adult mortality. Okay, so now let's go back and just think of what we did and what we learned in the earlier weeks, particularly weeks 2 and 3. And what are some key areas for intervention in all of these age groups? Well, for children, the really important item is to look separately at deaths in the first month of life and at ages 1 to 59 months. India needs to do a lot more with basic services such as early neonatal care so that neonatal deaths are addressed. Remember, neonatal deaths are a rising proportion of a falling total of child deaths. Second, India doesn't have any major problem with HIV, so the real emphasis at ages 5 to 49 is focused on malaria deaths, which in our studies from the Million Death Study are much larger than the World Health Organization estimates, but also on tuberculosis, which is a leading cause of death. Now, for malaria, the biggest threat to Indian malaria control is drug resistance. So I would advise Mr. Modi to put some money into the fight against malaria resistance in the greater Mekong region, as you learned in week 3. Now, it's not intuitive, but the best battle India can wage on malaria is actually on the Cambodian border. At these ages, 5 to 49, you also heard from Anna Dare and Michael Phillips that there are important avoidable burdens, particularly from suicides and also road traffic injuries. Finally, for the non-communicable diseases, India can immediately take steps to raise taxes to discourage smoking and other strong measures to curb tobacco consumption. It can also provide, as you learned, low-cost secondary treatments with simple pills for vascular disease, which is the leading cause of death at ages 50 to 69. And these kind of treatments can be made against common cancers. Finally, my advice to Prime Minister Modi would be to ensure the generation of robust evidence that tracks these simple changes which you've seen in these 3 spreadsheets over time. Thankfully, the ongoing work of the Registrar General of India and the Million Death Study enable exactly that kind of measurement.